I know it's important for you to pass your state and CMS survey, but it's not just about passing. It's about protecting your healthcare workers and your residents. And in this video, I'm going to show you how to do that. Hi guys, I'm Dr. Buffy, and my job is to help you pass your state and CMS survey. What I'm seeing across the country are facilities struggling to keep up with the constantly changing guidelines, and then having state surveyors come in unannounced and you're not prepared to pass. So what I'm going to do in this video is take you step by step through the CMS survey and how you can appropriately pass. First, it is really important that you follow all of your county, state, and federal guidelines. So make sure that you are in alignment with all of your state regulations. And now we can go to the CMS Assessment on cms.gov. It's really important to check this site often at cms.gov because these surveys update very frequently, especially right now during this pandemic. And so as we go through this assessment, it's important to understand that these can frequently change. So as we're going through this CMS assessment, we look at the different topics that the surveyors are going to be looking for. And the first area that we're talking about is actually the general, standard, and transmission-based precautions. Now within this section, you have general standard precautions, hand hygiene, as well as personal protective equipment, which we know everybody is struggling with at this time. So it's critically important to go through each of these steps and be able to ask yourself, am I able to implement these within my facility? And once you check off that section, you can go on to the next. The section for transmission-based precautions is really important as it goes through the different areas of resident care for droplet, contact, and airborne precautions. And this is important as you navigate whether you have a non-COVID unit or a COVID unit. This guidance changes, so you want to make sure that you're meeting these guidelines according to what your facility policy is based on the practices for this current period of time. As we go through, we're looking at resident care. Are residents on the appropriate transmission-based precautions for their specific infections? As you go through and check the different criteria, it's a guideline for you as well. It's not just to be punitive, but this tool can actually support you in making sure that you implement evidence-based practices. The next section we look at is infection surveillance. Now, everybody's reporting to NHSN right now their COVID data. This section will help you to making sure that you're actually recording other surveillance data, such as signs and symptoms of the residents and staff related to COVID. Another area of infection surveillance is actually how many healthcare workers have been tested and positive for COVID. So going down these different steps will help you to identify what gaps you may have and what areas you need to focus on your surveillance. A really important section that a lot of you are working on right now is that visitor entry. Do you have the good process when visitors come into your facilities for screening? Are temperatures being taken? Are the appropriate measures implemented for that screening? Education, monitoring, and screening of staff. Does everyone within your facility understand the COVID and what is indicated for your facility, such as the transmission-based precautions, the PPE? Do they understand? The state surveyors definitely ask these questions when they come into your facility. They want you to educate them on COVID, so make sure you have that really nailed down. Reporting to residents, representatives, and families. This is really important as you have a COVID positive case, then you're able to communicate this effectively to the families of those residents. You want to make sure that you provide that personally identifiable information to the families so that they know exactly what's going on with their loved ones. Reporting to the Centers for Disease Control and Prevention. This is definitely reviewing CDC data that your facility is reporting to once a week. This is the data that you're reporting to NHSN. The next section is emergency preparedness and staffing for emergencies. As we all have experienced during this pandemic, staffing is a huge need right now. Many facilities that I see are down 50% in their staffing needs. So this is the opportunity to make sure that you have an emergency emergency plan in place that helps your facility implement what they need and care for the residents. Did you know that as of November 28th of 2019, every skilled nursing facility in the country is required to have an infection preventionist trained on site at least part-time? This new guidance that's been updated and in this CMS assessment has it highlighted in red. So that is an indication to you that state surveyors are coming in and they are making sure that this role is being filled. And of course, we want this role to be filled right now because we're in the middle of a pandemic and infection control is critical to being sure that we're mitigating the infections within your facility. Another section is staff and resident testing. There are a lot of changes in relationship to testing right now. And so it's really important, as I indicated earlier, to make sure you're following your local and state guidance related to your testing protocols. This assessment can help guide you in making sure that your protocols are appropriate and up to date. But you always want to make sure you're abiding to all of those requirements. Finally, there is staff and resident testing. There is a lot of changes going on right now in relation to how we're testing our staff and residents. Some protocols require weekly testing, others monthly testing. So it's critically important that you follow your state and local guidance, make sure you're adhering to all of their regulations. And this assessment is going to help you navigate and making sure that you're in alignment with the protocols that you need to follow. If you're interested in learning more about how you can effectively implement transmission-based precautions within your facility, check out my next video. I just hate using the word survey so much. I'm like surveyors, but maybe it doesn't matter, so. Okay, I'm gonna do it. I'm gonna do it really good this time. See, I learned too. Okay.